Hi everyone, my name is Devon Reynolds, and today I will be answering my research question, does creatine supplementation help gain muscle mass? So in this video, I will first explain what creatine is and how it works, then I will show research and evidence that answers my question, and finally I will give my own opinions and thoughts on supplementing with creatine. So creatine is a substance that's found naturally in your body and your skeletal muscle cells. It's made by your liver, kidneys, and pancreas. It's an endogenous amino acid derivative that's produced by your body after eating protein, but it can also be found in some foods like seafood and red meat in very small amounts. And it is currently one of the most tested and researched supplements because it's very popular among bodybuilders and athletes. So, creatine increases your body's ability to produce energy rapidly. It is converted into phosphocreatine, then transferred into ADP, which converts into ATP. So, the more ATP you have in your body, the better your body will perform during high intensity exercise. It also saturates your muscle stores with water and gives them a bigger, fuller appearance. So, creatine can be taken in two different ways. It can be taken through a powder form or a pill form, but both are equally effective. And many people choose to do a loading phase where you take 20 grams a day for 7 days and then follow that by taking 5 grams consistently. This maximizes your creatine stores the fastest, but it's just as effective to take 5 grams a day from the beginning and be consistent with that. And because creatine is pulling water into your muscle cells, it's important to drink a lot of water, around a gallon a day, to avoid any dehydration or other side effects. So there are two different kinds of creatine. There's creatine monohydrate and creatine hydrochloric acid. They're both equally effective, although there's been some research that hydrochloric acid is more efficient when it comes to absorbing creatine into your cells more rapidly. So now I'm going to show my evidence and studies that I looked at in order to answer my research question, does creatine supplementation help gain muscle mass? So the first study that I looked at was administered to examine the effects that supplementing creatine has on physically active young adults during resistance training sessions. The effects they focused on included skeletal muscle mass and exercise performance, and seeing if there were any changes while supplementing with creatine. So, a double blind clinical trial was administered where 22 participants were randomly selected to supplement with creatine or a placebo for 6 weeks during resistance training. And participants of this study also filled out a 3-day food log to determine if their calorie intake had changed at all. So, they found that the group that supplemented creatine had an increase in weight from multiple strength exercises, while there were little to no changes in the placebo group. The creatine group also had an increase in muscle mass and improved their endurance. So the chart on the right is a summary of their recruitment of participants, allocation of creatine and placebo, as well as analysis of data. And then the chart at the bottom shows changes in certain exercises like leg press and chest press, and total body strength as well. So we can see that the creatine group had a significant change in endurance, so it can be concluded that taking creatine while resistance training increases muscle mass and strength. The second study that I looked at was conducted to describe patterns of creatine use in Division I collegiate athletes based on recommended dosages according to body weight and to report negative or positive side effects of supplementation. So, an anonymous questionnaire was sent out to 219 athletes where they were asked to answer questions on their patterns of using creatine during the loading and the maintenance phases. They were asked to describe positive, negative, or no side effects that they experienced. It was found that 41% of athletes reported using creatine, with more men than women using it. 89% of the creatine users that reported positive effects were at or below the recommended dosage for the loading phase, but above for the maintenance phase. And 38% of users reported negative effects, but they were also at or below the recommended dosage for the loading phase and above the maintenance dosage. Every creatine user that reported negative effects also reported positive effects. So it was concluded that there are positive effects associated with taking creatine as an athlete, like strength gain. And even if there were negative side effects, the athletes reported that the positive outweighs the negative. So the chart on the right shows data regarding overall creatine use according to creatine dosages above, at, and below recommendations for the loading and maintenance phases, and the overall number of athletes who reported effects according to the loading and maintenance dosages. So, the final study that I looked at was conducted with the goal of evaluating the effects of creatine supplementation on sport performance and muscle damage biomarkers while participating in complex training for 4 weeks. So, this was a double blind study where participants either took creatine or a placebo. The creatine group was assigned to the loading phase, which consisted of 20 grams for 6 days, and then was followed by 2 grams a day for the remainder of the study. So it was concluded that supplementation of creatine combined with complex training had an effect on maximal muscular strength and reduced muscle damage during training as well. After extensive research on creatine, it can be seen that it is a safe and effective way to help improve your strength, increase muscle mass, and reduce muscle damage and help your body recover quicker after a workout. I personally will continue to take creatine, and I've been taking it for a few months now and seen some really positive changes. And I would also recommend it to anyone looking to gain muscle or further their athletic abilities.